Medicare programs that can help, LIS and MSP, presented by the Michigan Medicare Assistance Program, or MAP, at the Area Agency on Aging, 1B. What we will cover. We'll cover MAP, who we are and what we do. Give you an overview of the LIS, Low Income Subsidy and Extra Help Program, the benefits of the program, and the eligibility rules. We'll give you an overview of the Medicare Savings Program, the benefits of the program, and the eligibility, and we will talk to you about how to apply. The Michigan Medicare Assistance Program. You may notice that we dropped the word Medicaid from our name. That's because a lot of Medicaid beneficiaries who are not eligible for Medicare were calling, and it got just too confusing. But we are still MAP. Counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance companies, and they are not licensed to sell insurance. In many states, MAP is called SHIP, the State Health Insurance Assistance Program. So how can a MAP counselor help you? A MAP counselor can help you understand your Medicare health plans, can help you compare and enroll you in Medicare Advantage coverage, compare and enroll you in Medicare prescription drug coverage, help you identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment into low-income programs like LIS, Extra Help, and Medicaid. Help with prescription drug coverage for Medicare, Extra Help, and low-income subsidy. Why does Extra Help and low-income subsidy matter? The cost of Medicare Part D drug plans can really add up. Part D plans, premiums, and deductibles, and prescription drug payments and coinsurance all can change every year. There's a significant poverty among the Medicare population. Nearly half, or 47%, or 25 million people have incomes under 200% of the federal poverty level. Many are likely eligible for low-income subsidies. The average value of a low-income subsidy for eligible persons is $5,000 a year. There's more benefits for Extra Help because it can help you access prescription drug coverage. It protects people from Part C coverage gaps. It waives any late enrollment penalties for Part D, and it allows for a continuous special enrollment period. LIS allows people to get prescription coverage, and without this program, many low-income seniors will forego Part D coverage and will not take the medications that are necessary to remain healthy. And it's important to know that you can change your plans once every 3 months, though it's not recommended, and you don't have to wait to open enrollment to change your plan. What is LIS Extra Help? Well, it has key federal players, which are the Social Security Administration and the Centers for Medicare and Medicaid Administration. They work together to administer and educate the public about LIS and Extra Help. Social Security handles the applications, the eligibility, and the determination. They provide the applications and make the eligibility decisions. CMS administers the program also. They handle the Part D plan assignments for those who are eligible, and they coordinate subsidies to Part D plans for eligible enrollees. What are the Extra Help eligibility rules? First, a person must have Medicare Part A and/or Part B to be eligible. They must live within the U.S. They must meet the financial eligibility criteria. Those are income and asset-based tests based on the annual federal poverty level. Some people automatically will get LIS, and those are Medicaid recipients. And once eligible, I'll get LIS for at least the remainder of the year and possibly beyond. So for example, if you qualify for LIS in March, you will have that benefit through December at the earliest. Levels of help. There is now only one level of help from LIS, and that is full help, or the full subsidy, for those with lower incomes and fewer resources. The partial help, or partial subsidy, has been eliminated for 2024 due to the Inflation Reduction Act. The Social Security Administration will be moving all persons with partial help subsidy to the full help subsidy. So if you are getting partial help, you don't need to do anything. You'll be automatically moved. The subsidy eliminates the Part D coverage gap, and the subsidy eliminates the late enrollment penalty. Extra help with Part D for low-income beneficiaries. These figures are from 2023. Statistics are updated in January or February of each year when the federal poverty level is adjusted for the year. So you can see, for those of you who had partial help, that the full help subsidy allows for a greater amount of income and assets, and that your drug prices will be less. Also, if you are Medicaid eligible, you'll have no premiums or deductibles. Same thing with full help, no premiums or deductibles. So there is an income test to see if you're eligible for low-income subsidy extra help. Countable income includes Social Security benefits, including retirement and SSI, railroad retirement benefits, pensions or annuities, including veterans' pensions, gross wages or earnings from self-employment, which a portion of which are not counted, alimony, net rental income, and workers' compensation. There are some things that are excluded from your income, which are SNAP or food stamp benefits, the LIHEAP benefit, which is your fuel assistance benefit, $20 monthly in unearned income, such as Social Security, and work-related expenses for people who get Social Security benefit from a disability or blindness. There's also a resource test, and your countable resources include financial institution accounts like checking, saving, or CDs, any cash you might have at home, stocks and bonds, savings bonds, mutual funds, individual retirement accounts or IRAs, and 401k accounts. Real estate, the equity value other than the primary home. You are allowed your home, and certain trusts that allow a person to revoke or have direct use of funds. Excluded resources include the home in which the applicant lives, all vehicles, auto, trucks, motorcycles, boats, snowmobiles, etc., your household goods, including furnishings and personal effects like jewelry, the cash surrender value of a life insurance policy, in-kind support, such as non-cash help, such as shelter, and irrevocable burial trusts or burial contracts. So how do you apply for extra help? There's different ways to do it. The first way and easiest is online at Social Security's website, which is www.ssa.gov. Their online application is available in both English and Spanish, and they will accept an electronic signature to complete the application. You can also get a paper form. It's a scannable form, not a photocopy form from SSA. You can get it either by mail or from the Social Security's office, and you must call Social Security to get the paper form. And as a reminder, Social Security makes the determination for the applicant, and it usually happens within 3 weeks of completing the application, and you will be sent a decision letter. Tips for applying for LIS extra help. Online is usually easier and faster. No verifying documents are needed. If a paper form is incomplete, Social Security Administration will follow up via a phone call with the applicant and online applications cannot be submitted until they are complete. If you need a multi-language sheet, they're available at Social Security's website at www.ssa.gov/prescription-help/EH_other languages. But you can find that by clicking on Social Security's website. Help for Original Medicare. Did you know Medicare isn't free? It is the primary insurance for seniors age 65 and older, and many younger adults who receive Social Security disability benefits. And for many people, Medicare can be unaffordable. But Medicare is not free, and the out-of-pocket costs add up. That's why MSP, or the Medicare Savings Program, is so important. This slide is an overview of the Medicare Savings Programs. The most beneficial is the Qualified Medicare Beneficiary Program, or QMB, covers Medicare Part B premiums, Medicare Part A premiums, and all Medicare Part A and B deductibles, coinsurance, and copayments. It's similar to Medicaid. The second program is the Specified Low-Income Beneficiary, or SLIMB program, and that covers your Part B premiums only. The third program is the Additional Low-Income Medicare Beneficiary, or ALMB program, that also covers Part B premiums, but only when money is available. So what are MSPs? MSPs are Medicaid-administered programs. MSPs help cover Medicare premiums and cost sharing for those with Medicare who have limited incomes and resources and do not qualify for full Medicaid. MSP essentially buys those who are eligible into the Medicare Part A and B, or both. Who is eligible? You must have Part A. You must meet the income resource and eligibility tests. Applications are submitted through the Department of Human Services, and eligibility is generally redetermined each year. Financial eligibility guidelines are set by law, but states can raise income tests or eliminate resource tests. For example, 8 states and Washington, D.C. have modified eligibility rules to eliminate the resource test for all of the MSPs. States have eliminated the tests are Alabama, Arizona, Connecticut, Delaware, Maine, Mississippi, New York, and Vermont. A note about the resource test. MSP has a basic resource exclusion from counted resources and a burial and funeral exclusion of at least $1,500 for individuals and $3,000 for married couples. The basic exclusion plus the burial and funeral exclusion are the same as the LIS exclusion, which includes the amounts of $1,500 and $3,000 for funeral and burial. Again, note that these numbers are for 2023. Numbers are adjusted early each year when the federal poverty level is adjusted for the year. Income note, these amounts are higher in Alaska and Hawaii. The income test goes up each year there is a federal poverty level increase. Federal poverty levels are announced at the end of January of each year. Resource note, the amounts do not include the $1,500 per person burial allowance. Most state Medicaid methodologies require that to be excluded, the $1,500 must be in a separate and identified bank account. Some states go even further and require that to be excluded, funds for burial must be placed in an irrevocable account, like a contract with a funeral home. Irrevocable means once the monies have been put into that type of account, your client cannot change her mind and get the money back. The good news is that some state Medicaid programs exclude more than $1,500 for burial, especially when the funds have been placed in an irrevocable account. How to apply for the MSP program. You have to complete an application. It's a paper DHS form. You can fax, mail, or drop it off at the local DHS office, or you can go online to www.michigan.gov/mybridges. You do have to provide required documentation. You have to provide proof of identity, such as a driver's license or social security card. You have to provide proof of income and assets, such as bank statements and pay stubs, and you have to provide insurance and other bills. We are here to help you. If you want to speak with a counselor about your specific situation, give us a call. Our service is confidential and unbiased. We currently counsel over the phone and Zoom. We are also counseling in person now. And no question is too trivial, and we often deal with very complicated issues as well. Please leave a message on our voicemail if no one answers. We run primarily on part-time staff, but someone will get back to you within a day or two. MAP counselors are trained staff that can help you learn about programs that can help answer questions on current benefits, screen for eligibility for certain benefits, and apply for benefits. To speak with a MAP counselor, please call 800-803-7174. That number again is 800-803-7174. Let's get started.